The number of COVID-19 cases and hospitalizations continue to increase in Kern County and across the country. Most of us see only the raw numbers, though not the suffering, not the drama, not the way the medical professionals see it in the ICU every day. 17's Robert Price spoke to one woman in the middle of a daunting battle against an invisible enemy, and he files this report.
COVID-19 cases have exceeded 1,000 for multiple days this week. It's a war zone out there, and here's one of the battlefields. Adventist Health in downtown Bakersfield is one of 10 acute care hospitals in Kern County with ICU capacity. And like all of them, the pandemic is stretching its resources. No one knows this better than Amanda Swanson, a charge nurse who is responsible for nursing assignments and patient bed movement based on severity of condition within the ICU. And right now, she's concerned.
We are very, very close to being full in the ICU. I was looking at the state numbers today on the dashboard, and we probably have a couple of beds before we go into overflow areas. So I would expect that to happen in the next day or two.
The nurses that Swanson works with deal with ongoing mental and physical fatigue. Although, she says, following that summer onslaught of cases, most have steeled themselves to the reality of the situation and are carrying on admirably. But some things aren't so easily overcome, emotionally speaking, even for nurses who see such things on a regular basis.
Because this is a contagious disease, one of the hardest things for us is seeing it affect families. We often will have spouses, husband and wife, who both have COVID, or we'll have mother and son, mother and daughter, father-daughter. We've had some sibling pairs. Just because it affects everybody in the family, everybody catches it. And having those patients in the hospital together, we've had a couple times where we have some shared rooms up on the floors, and if possible, we'll try and put spouses together. But we've had some times where one of the spouses has gotten sicker than the other and has had to come down to the ICU. And that's always been very hard because you're seeing them saying goodbye. And they don't know, and you don't know if they're going to see each other again. And we've had a couple unfortunate cases where one family member has been hospitalized, intubated, sedated, and another family member has gotten ill, been hospitalized, and passed away. And then when they wake up, somebody has to tell them that, their loved one is not with them anymore. And that's always very hard for us.
Then there is the occasional COVID denier, a patient or family member who refuses to believe the pandemic is as serious as it's been portrayed.
I had a family member get very angry with me, actually. He was very upset. He was yelling. He told me, you need to let my family member out. If this is just COVID, he's fine. He doesn't need to be there. And trying to explain, we can't take him off the oxygen. If we take him off the oxygen, he won't be able to breathe adequately, and he'll die. And this person was just so upset that it's a lie. You're lying to me. This is just COVID. Let him go. It's not a problem. And trying to get him to, and he never did acknowledge or seem to understand what I was telling him. That patient, unfortunately, did not recover.
One of the challenges COVID ICU patients face, and consequently the nurses who care for them, is that this can become an acute, debilitating illness that requires staff to sedate and in many cases administer paralytics so the patient can't move.
They are fully sedated, and sometimes because of the severity of the disease or because we're having to do what's called proning therapy, we're actually having to give them paralytics. And those keep the patients from fighting the ventilator, from trying to breathe against it too much. Because what we're doing is we're taking those patients and we're turning them on their stomachs. And we're maintaining them on their stomachs for upwards of 16, 18, sometimes 20 hours at a time to help shift the areas of their lungs that can expand and get oxygenated.
Take the proper precautions and know that you have greatly diminished your chances of meeting Amanda Swanson or one of her nurses in the Adventist ICU. But know, too, that if that should happen, you'll be in battle-tested hands. Battlefield equipment's pretty simple. Masks and social distancing. In downtown Bakersfield, Robert Price, 17 News.